Hi everyone, I chose to speak about Epic systems. Epic EHR was founded in a basement in Wisconsin in 1979 by Judy Faulkner. They celebrated their 40th anniversary in March of 2019. They currently have 10,000 employees. They have a very employee-centered approach. They have a yes-if culture rather than a but-no culture. They reward their employees a lot. If you've been with them 5 years, you get 4 weeks of paid time off. If you choose to visit a country that you've never been to before, they will actually pay for you and a guest to seek out that country. They have currently done more than 3,000 trips to 100 countries. I think that's amazing. It's dominating the EMR market right now. As of April of 2020, they had 29% of the EMR market, and with Cerner being right behind them at 26%. So as you can see, they're used a lot in this country right now. They generate $2.9 billion of revenue each year. Their 40% of their operating expenses are on R&D. So they don't rest on their laurels. They are constantly researching and developing new ways to use EMR and EHR and to make sure that they're staying ahead of the game. They are currently rated the best ambulatory EMR and acute EMR for ambulatory settings as far as physician productivity and effectiveness. So it's, it definitely tends to pay for itself is what we're hearing from the masses. They're very patient-centered. They have their portal is called MyChart. I personally have a MyChart because our local hospital has Epic. It's very user-friendly. Everything that's pushed out to the portal is very easily readable, and lots of information available on the portal. Epic can be tailored to fit any system, whether it's an outpatient system, ambulatory care, hospital-based system, lab, any type of facility rehab, any and all specialty services or ancillary services needed. That is why a lot of very large practices tend to use Epic. So for example, Vanderbilt or Mayo Clinic, both really big users of Epic. They have predictive analytics and embedded decision support tools. I know a lot of EMRs have them, but theirs are pretty swift. Had the privilege of working in Epic. We personally don't have it, but I do have had the privilege to work in it in our hospital, and it's pretty darn good. The EMR is available to providers on mobile devices such as phones, tablets, watches. This is important to providers. Those of you who haven't worked in healthcare yet will find that anything that can ease the provider's access, if they can get it from anywhere when they need it, that's important. If they're on call or if they're needing to go to the hospital, if they can quickly and easily access it from any of their devices, that's important. They have a lot of telehealth services, and they were actually pretty big on telehealth prior to COVID. So when COVID hit, it was extremely important that they had it in place for, they were using it before for like specialist referral services, patient monitoring, peer-to-peer consultations, meaning a second opinion, or video visits of all sorts. So those video visits came in extremely handy with COVID and the patients. For revenue cycle, they have automate their revenue encoding for clinical activity, which will reduce overhead. This is one of the areas where I'm not as actually comfortable. Being a certified coder, I'm a little leery of some of those auto codings, but theirs is actually pretty good. I'll have to say I'm pretty impressed with it as well. It'll consolidate patients' outstanding balance on the system. So, for example, if somebody's in this entire system, they have an outpatient visit, they have a hospital visit, they can get one outstanding balance for all across the system. They assist with managed care eligibility, utilization management, claims, and care management. They have a lot of agreements in place with a lot of the big payers, so it's pretty automated and pretty slick, which is nice. They have a lot of population health elements within their EHR. They have a plan of care. They do care gap reports and have advanced analytics for that. The care gap reports are really nice. You can run that before a patient arrives to know what they're missing. So for example, if the patient's missing their colonoscopy or if they're missing their mammography, you'll know when they come in to remind them that they do that. Their AI and analytics department, they have a lot of decision-making tools with advanced machine learning, algorithms and benchmarks. They have data from over 250 million patients in the system to compare with. So that's where that being large helps. Something that's pretty interesting is their Cosmos program. They have mined de-identified data from 8 million patients in 9 health systems, and most recently 30 more systems have signed on to participate for research in treatments. So I think they're using all of that patient data for good, obviously de-identified, but trying to get more research on patient outcomes. The Care Anywhere interoperability is huge with Epic. That's something we see in Southern Illinois when our patients visit the doctors in St. Louis at Barnes-Jewish. We can see those records within Epic for Care Anywhere. So if a patient is seen anywhere in the United States that has Epic, we can click Care Anywhere, we see it. So our elderly patients that go to Florida for a few months, and if they're seen in a system that has Epic, we can see that in Care Anywhere. That's huge. So more Epic users have attested for meaningful use than any other EMR out there. I think that's big for practices. It helps them to achieve MIPS or ACOs or any of the other quality care programs in an easier manner. And I think that goes back to them having their ducks in a row with all of their templates and the way to be able to pull data and having that data to compare against the United States. So by far, I think my opinion, like I said, we're not currently on Epic, so I've had experience with 4 EHRs in my career, and my opinion is Epic is pretty slick, and we like it. Thanks.